health issue, and it is not talked about enough. What is the cost of this disease burden on the economy, both local economies and global economy?
It's devastating. Just think about the numbers. So, I mean, we kind of started talking about the cancer explosion, right? So in Africa, we believe that there'll be about, the estimate from the Lancet Oncology Commission is that by 2030, we'll have about 1 million cancer cases, deaths per year, right? And right now we have about 550,000, more than that, deaths per year. But because of COVID and other factors, we actually underestimating, because right now, like you and I discussed, people even die of cancer and don't know they are dying of cancer. As we get this awareness that you're creating, people get aware about it, you realize that there are more people dying. So it's a pandemic worse than COVID. If we really have to look at the COVID-19, just based on how many people is killing, we need to bring that same urgency to cancer. And so, in sub-Saharan Africa, from those statistics, there are about 120,000, cases per year for cervical cancer. So it's second after breast. But in terms of death, we 70% of those, about 70% of those with cancer die. And so that's about 80,000 women dying per year. I can tell you that that's actually underestimated. But those are the statistics we're talking about. And so, to your question, when you have these kind of numbers, we really have to look at ways that we have to address this. And I think that, one of the key things, like focusing on women's health, it's really the priority, because, by the way, women are the engine in Africa. Without women in the African culture, I mean, they're really the engine of the society. And I think that, that's why you have the focus of your project is going to have a really big impact. In terms of the economic cost, when we're launching the Lancet Commission, we actually went to Nigeria, and we presented the numbers. The number of cases going to die. Okay, 1 million deaths per year by 2030. Nigeria is 1/6 of Africa, so it means you're looking at a large number of people dying. But then we said, well, Nigeria lost about $5.6 billion in 2019 due to cancer alone. And then the Congress people, the parliamentarians who were in the audience, they were like, what? Everybody stood up. They realized that it's not just, people dying. Even if you don't care, about the people who are dying, some people care about when you put that money amount, the impact that it's having because of lost wages, because women who are really productive, they are no longer being able to contribute to the economy, the cost of care and things like that. So investing in making sure that our women get cured and survive from cervical cancer is good, not just for the women, it's actually good for economic development for the country.